Hi, it's Dr. Jenny again, here to talk to you about both internal and external parasites. So let's jump right in and start with the 4 most common intestinal worms. Roundworms are the most common parasite found inside your pets. Almost all pets become infected with them at some point in time in their lives because they can be contracted in different ways. Puppies can be born with roundworms because they spread from the pregnant mom to her babies and also can be shed in her milk. Pets can also contract it from the environment or even from predation, which means eating small prey. Many animals do not show signs of infections. You may see diarrhea, vomiting, weight loss, a dull hair coat, or a pot-bellied appearance. Roundworms do pose a risk to humans. People can get roundworms just from contact with contaminated soil or feces that results in ingestion. So it's important to pick up your pet's feces, wash those hands, and not let children play in contaminated areas. Hookworms are the second most common parasite, and they live in the intestinal tract and feed on your pet's blood. Eggs are shed in the feces, and the larvae, which live in the soil, can infect you or your animals through ingestion or even can burrow through your skin. Signs of hookworm infestations can be more severe due to the fact that they feed on blood. Mild signs include weight loss and diarrhea. Severe infestations can lead to blood loss, bad enough to be fatal without a blood transfusion, especially in puppies. As stated before, hookworms do pose a risk to humans who can contract these simply by walking barefoot in a feces-contaminated area. Whipworms are one of the 4 most common intestinal parasites of dogs. Pets get them by ingesting infected eggs from feces-contaminated soil. Many dogs do not show signs of infection, but severe infestation can cause bloody diarrhea, weight loss, and even death. Tapeworms are common worms which pets get from ingesting fleas or eating small prey like rodents, rabbits, or squirrels. Pets usually show no signs of tapeworm infestation, but you may see segments of worms that look like grains of rice or seeds on the rear end or in their stools. Prevent tapeworm infestations by keeping your pets on flea control regularly and reducing or eliminating the eating of wild animals. So, how do I know if my pet has worms? Sometimes you will see adult worms in the stool or vomit, but often those adults stay in the intestines and only shed microscopic eggs. A fecal test run by your veterinarian will find any eggs. Tapeworm eggs are notorious for not showing up on fecal tests, but you can see the rice-like segments adhering to the stool or rectum with the naked eye. So how do I treat for intestinal worms? Many over-the-counter dewormers will work for roundworms and hookworms, but specific or stronger ones may be needed for whipworms and tapeworms. Many heartworm preventatives can control these worms and are often cheaper than individual doses of broad-spectrum dewormers, especially when considering that pets can get infected or can get reinfected as early as every 2 weeks. Talk to your veterinarian about prevention and treatment just to get rid of those worms. Everybody hates fleas. They are everywhere, and they make us and our pets miserable. They also stick around in winter on our animals, making this problem a year-round issue. Have you seen a dog like this? This itchy hair loss is caused by fleas. Fleas are a common external parasite of both dogs and cats. Adults drink blood and can cause anemia in very severe infestations. Apart from sucking blood, fleas can transmit tapeworms and bacterial infections. Adult fleas live on the pet, and each female flea can lay up to 50 eggs a day. Those eggs roll off the coat and infest your home, then hatch, and then just contribute to the cycle. How do you know if your dog or cat has fleas? Look for itching, hair loss, and flea dirt, which is actually flea poop. Also, you can see the adult fleas on your pet by parting the hair and looking at their skin. Fleas love to live at the base of the tail, called the tail head, and also on the belly. Pets acquire fleas from kennels, groomers, stray dogs or cats, or wildlife that wanders through the yard. Contrary to popular belief, fleas seldom jump directly from one pet to another, but those newly hatched fleas from all those eggs, those Those will jump on anything that moves. Once on the pet, this is where the flea likes to stay. Therefore, treatment of the pet is an essential step in ridding a home of fleas. How do I treat for fleas? We have already established that treating the pet is essential. Talk to your veterinarian about safe and effective flea treatment. Remember, some products should not be used on cats. Over-the-counter products that I recommend are Advantage for cats, Advantage 2 for dogs, and the Seresto collar. Other flea pills are available by prescription from your veterinarian, like NexGard, Simparica, Credelio, Bravecto, and Comfortis. Unfortunately, we are seeing much resistance to flea products. So if you feel like you are treating and still not seeing a difference, speak to your veterinarian. Unfortunately, the day you see fleas on your pet means that we have at least 3 months of treatment. The flea eggs takes 3 months to hatch, larvate, and become strong enough to jump on your pet, and then, with appropriate treatment, will bite and then die. What about treating my house? To hasten the elimination of fleas within the home, you can wash pet bedding and vacuum. Vacuuming removes many of the eggs and larvae developing within the home. Don't forget to vacuum along edges of rooms, beneath furniture, cushions, beds, and throw rugs. After vacuuming, seal the vacuum bag in a garbage bag and discard in an outdoor container. It is my opinion that simple vacuuming and treating all pets is the best and cheapest way to take care of an infestation. If seeking flea bombs or other applications, please speak to your local veterinarian or pest control personnel. How do I prevent my pet from getting fleas? Pets are at continual risk of picking up new fleas outside or at the kennel or groomer. The best way to avoid infestation is to keep pets on a preventative treatment like those mentioned before. Also, continue to use preventative year-round. North Carolina winters are not tough enough to stop infestations, and no matter how cold it is outside, once they are on your pet and in your house, they are there to stay until appropriate treatment is sought. Ticks. Tiny spiders coming for you and your pets. Watch out! Ticks are technically arachnids and not insects, but this doesn't make them any pleasanter. Ticks can transmit a wide variety of diseases to pets and people and are active throughout the year. Tick control must be done consistently to protect the health of your pet and to prevent untreated pets from bringing in ticks, which may then infest people. Not only can ticks spread diseases, but they can also cause local irritation and itch around the attachment site, as well as anemia from blood loss. Diseases that ticks can spread include Lyme disease, Rocky Mountain spotted fever, ehrlichiosis, anaplasmosis, and tularemia, just to name a few. Did you know that the tick that carries Lyme disease are more active in winter than summer? That's why it's important to keep your pets on tick preventatives and to check yourself frequently. Luckily, many of the commercial flea preventatives have tick preventatives as well. Over-the-counter options include Advantage 2 for dogs and Seresto collars. Also, flea tick pills can be purchased with a prescription from your veterinarian. The same products that work against fleas are also effective against ticks, like NexGard, Simparica, Credelio, and Bravecto. What do I do if I find a tick on my pet? You can remove ticks manually by using fine tweezers to grab the tick as close to the skin as possible, then remove using slow, steady pressure. Gloves should be worn to prevent infection. Care should be taken to avoid crushing, twisting, or jerking the tick out of the skin because this may result in increased exposure to the diseases within the tick. Moving on to heartworms. Heartworm disease is a serious and potential fatal disease of pets caused by foot-long worms that live in the heart, lungs, and associated blood vessels. This can cause severe lung disease, heart failure, and damage to other organs. Dogs and coyotes are the natural host for heartworms, meaning they breed within the dog. How does my dog get heartworms? The mosquito is essential in transmission of heartworms. Mosquitoes feed on the blood of an infected dog, and the heartworms then develop within the mosquito into the infective stage. Then, when the infected mosquito bites another animal, heartworm larvae are deposited to infect the new animal. Mosquitoes can fly up to 3 miles, so if you or your neighbors have a heartworm-positive dog, or coyotes are common in your area, then your dog is at risk. 3 miles is the same distance from Conley Springs to Valdez. Once infected, it will take 6 months for your dog to test positive. And those heartworms can live for 5 to 7 years in your dog's heart. Once infected, dogs have irreversible damage to their heart and vessels. But heartworm disease and positivity does not always mean death. How do you know if your dog is heartworm positive? A simple blood test is all you need to know if your dog has heartworms. It is recommended that a heartworm test is run for every dog annually. What do I do if my dog is positive for heartworms? First, your veterinarian will confirm the diagnosis, and then you should immediately restrict exercise, because the higher your dog's heart rate, the more likely the heartworms will cause damage to the heart and lungs. Treatment is sought once the dog is stabilized if it is showing signs of heartworm disease. Not all dogs show signs of heartworm disease. Those that do usually have severe disease. Signs to watch out for include persistent cough, reluctance to exercise, fatigue, reduced appetite, and weight loss. As heartworm disease progresses, dogs may develop heart failure and will have the appearance of a swollen belly due to fluid accumulation in the abdomen. Treatment is available for animals with heartworm disease. However, once infected, every treatment has risks. The more severe the signs, the higher risk. That is why prevention is key. Treatment includes oral medications, blood work, x-rays, and injections. The average cost for this treatment in Burke County for a 50-pound dog is $600 to $1,000. Dogs with no signs or mild signs of heartworm disease have a higher success rate with treatment. More severe disease can also be successfully treated, but the possibility of complications is greater. So what can I do? Talk to your veterinarian to make sure your dog is negative for heartworms, and then start your dog on a monthly preventative. It is recommended that every dog be on heartworm prevention year-round. Heartworm prevention is also quite cheap. A 6-month supply for a dog ranges on average between $35 and $80. Also, these preventatives usually have the added bonus of deworming your dog for intestinal parasites. Heartworm prevention are usually chewy treats that your dog will take orally once a month. There is also monthly topical treatments for those dogs who are picky, or even 6 or 12-month injections to prevent heartworm disease. Talk to your veterinarian for more information on starting or continuing your dog on heartworm prevention. When to visit your veterinarian. Other than sick visits, your pet should see a veterinarian at least once a year for a wellness exam, vaccines, and a heartworm test. These prevention medicine visits are vital to help establish normals for your pet and to find abnormalities before they become a problem. Veterinarians will often recommend routine blood work screening for your pet to check their internal organs like their kidneys and liver. This becomes more important as your pet ages in order to catch serious diseases sooner so appropriate treatment can be started. Did you know it is not legal for a veterinarian to prescribe medication to an animal without a recent examination? That is why a pet needs to be seen annually, especially if receiving prescription medications. Please call or visit many of our amazing veterinarian clinics in Burke County. Be advised that due to the unprecedented increase in pets and the veterinarian and staff shortages, that wait times may be longer. Remember that it is up to you to protect the health of your pets. You can do your part by spaying and neutering, keeping them up to date on their vaccines, and protecting them from both internal and external parasites. Also know that Burke County Animal Services is here to help and serve you. Contact them via email or stop by to get more information on preventative care.